In today's world, mental health is finally getting the attention it has long deserved. We're encouraged to speak openly about our struggles, seek therapy, and prioritize emotional well-being. And that's a good thing. But as the conversation grows, a new question emerges: are we starting to pathologize normal emotions? In other words, are we turning everyday feelings, like sadness, worry, or stress, into symptoms of a mental disorder? Let's unpack this growing debate and examine both sides of the argument. Thanks to social media, awareness of mental health issues has skyrocketed. Posts about anxiety, depression, and trauma fill our feeds. Online therapy is booming. People are diagnosing themselves based on relatable infographics, TikTok videos, and short quizzes. But here's the concern: in trying to normalize mental health, are we sometimes going too far, labeling normal emotional responses as disorders? Take sadness, for example. Feeling down after a breakup, grieving the loss of a loved one, or feeling unmotivated during a hard season of life, these are all natural responses to real-life challenges. Yet, when these emotions get labeled as clinical depression without proper evaluation, we risk misunderstanding the true nature of mental illness. Mental health professionals agree that emotions exist on a spectrum. Sadness is not the same as depression. Nervousness isn't the same as an anxiety disorder. And a bad day doesn't always mean you're mentally ill. Yet, in the rush to validate emotional experiences, we might blur the line between discomfort and dysfunction. This brings us to the core of the debate. Advocates for increased awareness argue that open discussion helps people seek help sooner. If someone sees a post about anxiety and realizes it describes their experience, it might encourage them to talk to a therapist or open up to a friend. But critics caution that self-diagnosing through social media can be misleading. Not every uncomfortable emotion is a disorder. In fact, some emotions are vital to our personal growth. Grief teaches us about love and loss. Anxiety prepares us for challenges. Anger can signal injustice. These feelings are not problems to be cured, but messages to be understood. When we pathologize every emotional low, we may unintentionally send the message that it's not okay to feel bad, even temporarily. That discomfort always needs a diagnosis. That natural emotions are problems that require immediate fixing. This mindset can lead to over-medication, unnecessary therapy, or dependency on diagnostic labels. It also risks taking away from the seriousness of actual mental illness, where people genuinely need long-term support and treatment. On the flip side, some argue that by naming emotions, even normal ones, we give them space and validity. A person struggling with emotional regulation might not have a full-blown disorder, but still benefits from tools like therapy, mindfulness, and emotional education. And it's true, our society hasn't always been great at handling emotions. For generations, people were told to toughen up, push through, or stop being so emotional. So the push toward mental health normalization was needed. But the pendulum may be swinging too far in the other direction. What we need is balance. We need to validate people's emotions without immediately turning them into clinical conditions. We need to promote mental wellness without promoting overdiagnosis. And we need to create space for both, those experiencing everyday emotional struggles and those living with serious, diagnosable mental illnesses. So how do we tell the difference? Here are a few questions to consider. Is this emotion persistent and interfering with daily life? Does it affect relationships, work, or physical health? Has it lasted for weeks or months with little relief? Is there a sense of hopelessness or inability to cope? If the answer is yes, then it's worth seeking professional support. Mental health conditions are real, and they deserve real attention. But if your emotions are tied to a specific event, temporary situation, or life stressor, it might just be part of being human. Feeling overwhelmed before a big exam? That's not a disorder, that's stress. Feeling sad after a loss? That's grief. Feeling anxious before a first date or a job interview? That's your body preparing for uncertainty. These aren't flaws in your mental health. They're signs that you're alive, connected, and engaged with your world. The key is learning how to understand, manage, and process these emotions, not suppress them, and not mislabel them either. Emotional literacy, knowing what you're feeling and why, is a skill we all benefit from. Mental health isn't just about avoiding pain. It's about building resilience. It's about knowing when you need help, and when what you're feeling is part of the normal ups and downs of life. So, are we pathologizing normal emotions? In some ways, yes. But that doesn't mean we should stop talking about mental health. It means we need to talk about it with more nuance, more wisdom, and more care. Let's embrace the full range of human emotion, the joyful, the painful, the confusing, and the calm. Because mental health isn't just about avoiding illness, it's about learning to feel, to grow, and to thrive. Let's keep the conversation going.